health, wellness, and you.
Week 2, Physical Health.
Here's CKDM News Director Matt Hamel.
This is week 2 of Health, Wellness, and You, and we're focusing on your physical health. Today, the expert we're speaking to is Dr. Nicole Culos-Reed from the University of Calgary. Dr. Culos-Reed will walk us through how we can harness physical activity as an effective way to manage our mental, emotional, and functional health. That's coming up next.
Many things have just stopped over the last few months, but there are some things in life that just don't stop for anything.
I was recently diagnosed with lung cancer. The strain on my family has been tough, but if it wasn't for the support of Central Plains Cancer Services and their transportation program, I just don't know where I'd be.
Cancer touches everyone. Your gift provides hope. Your donation stays right here in our region to help our neighbors, family, and friends. Check your mail for your donation card or donate online at centralplainscancerservices.com.
This is Health, Wellness, and You, and today we welcome Dr. Nicole Culos-Reed from the University of Calgary. Dr. Culos-Reed, I want to start by asking you this. What are some of the most significant challenges to maintaining our overall health during this current situation?
That's a great question. I think we've seen a couple of things. One, we know in general, physical activity levels have diminished. So we're seeing a decrease in people's movement overall. People stop going to the gym, their usual fitness classes. Many people are working and staying at home, and there was a lot of just stay at home, right? And so I think we saw physical activity levels overall decline. And because of that, we see a number of health diminishments, decreases in physical, functional, social, emotional, and mental well-being have all diminished because of that lack of physical activity. There's a larger movement called Exercise is Medicine, and it's an international movement, and we have a strong Canadian group in that. And it really is true that exercise is one of the very best medicines we can do for our overall health and well-being. So when we take that away and people are naturally more sedentary, we're seeing those lasting impacts.
You've touched on it there, but let's go a bit deeper into that point. In what ways is physical activity and exercise kind of pouring over and benefiting other areas of our health, like our social, mental, and emotional health?
Yeah, so sometimes I think there is that pour over, as you just said, and sometimes it's really independent of. Right? So we know that for some of the physical changes associated with exercise, a certain dose is often required, right? So if you think of fitness outcomes, we need a certain dose for somebody to build larger muscles or to get more aerobically fit. Sometimes that pours over, as you said, into other domains. So if when they're more physically fit, they may have more energy to therefore socialize and to engage in those relationships that really bring them that sense of well-being in that social domain. Other times, however, I think you can think about physical activity and its independent impact. By that, I mean decreasing depression, anxiety, and stress. And so when we can use exercise simply for those outcomes, it doesn't work through physical changes necessarily. It's got an independent effect on those outcomes. So we know that exercise is one of our best tools for, non-severe levels of clinical depression. Right? It's as effective as some of the standard drug therapies and doesn't have any of the negative side effects. So often we're looking at some of those benefits. Sometimes being in a physical setting can afford people social connections. It can afford people feeling better, that endorphin rush. So there is a physiological link to some of those more mental health outcomes. But I think if you think of your daily activities, and sometimes when you're stressed out and you just need a 5-minute break outside, and that recharge, we wouldn't count it as exercise per se, but that movement absolutely has you feeling more in control, decrease your stress, and now you're ready to go back and tackle whatever's next.
And if you'd like to hear my full conversation with Dr. Culos-Reed, make sure to head to 730ckdm.com, click on the Health, Wellness, and You page. Now I'll be right back to tell you who we're speaking with tomorrow on Health, Wellness, and You.
Parks Edge Physiotherapy is now open at 420 Main Street North in Dauphin, and they're accepting new patients. Physiotherapy focuses on movement along with active participation to restore, maintain, and maximize strength, physical function, and independence. If you're having problems with any of these, contact them today. And they make it as simple as possible with direct billing to most insurance providers and by offering services to WCB and MPI clients. If you have any questions or would like to book an appointment, contact Parks Edge Physiotherapy at 204-638-9642 or visit them at parksedgephysio.ca.
Coming up tomorrow, part 2 of our conversation with Dr. Nicole Culos-Reed. Now, we've talked about the importance of exercise. Tomorrow, we'll get some advice on how to get a physical activity routine started in your life. This is Health, Wellness, and You, a 4-week journey on 730 CKDM, exploring the benefits of balancing your physical, mental, spiritual, and emotional health, and all the benefits that can bring to your life. Make sure to head to 730ckdm.com, click on the Health, Wellness, and You page for the full-length conversations with the health experts.
CKDM's Health, Wellness, and You feature series is brought to you by Central Plains Cancer Services, Parks Edge Physiotherapy, Dauphin Clinic Pharmacy, Dr. Brenna and Three Graces Medispa, Dauphin Chiropractic Center, Nutter's Everyday Naturals in Dauphin, Parkland Collaborative Legal Options, Fusion Credit Union, and Sunrise Counseling in Dauphin. Listen to CKDM Radio twice daily at 7:15 and 3:15, or listen anytime at 730ckdm.com.